Oh, yeah, see, no, this comes right in. This is the same thing as on the shoulder pain and just like, this is, you know, this is basic. Yeah, this is something that you get up. Okay, so then.
If anybody has just hopped on to the Facebook Live, we are probably going to wait just a couple minutes to get started. Testing 1, 2, 3. All right, we'll go ahead and get started. So just want to thank anybody who is here with us live right now. We appreciate your attendance, and we hope that this presentation serves you. So my name is Josh, and I will be doing the presentation today. Frank did the knee pain and dysfunction seminar last week, and so this week it is my turn, and Frank will be monitoring the chat box. If anybody has any questions, they can direct those to Frank in the chat. So Frank and I are inside the Ogden Athletic Club. We're the little physical therapy and balance clinic inside the club there. Before all of this virus craziness happened, we were doing these seminars live in person in the club, and we were having a lot of show up to these seminars, and so we decided that with some more downtime right now because of the virus, that we would still try and do these seminars, and we're thankful for the technology that allows us to still do that. So hopefully this serves you. So here's an embarrassing picture of us, just so you can still see our faces. You can tell which one is me because I'm the handsome one, and I'm actually smiling. So, oh, I guess our names are down at the bottom there too. Like I said, my name is Josh, and Frank is there. A lot of you probably know him. But so today we will be talking about shoulder pain and dysfunction. Okay, so this is the shoulder pain and dysfunction seminar if you're just hopping on. So before we kind of really get into things, go grab your popcorn and drinks because this is going to be good. No, we first probably need to talk about a little bit of the anatomy of the shoulder. Okay, so just kind of so we have an understanding of what we're dealing with. So the shoulder joint is a pretty complicated joint. It's not like the knee, where the knee just flexes and extends. The shoulder's kind of got a lot more going on. Okay, so you have flexion and extension of the shoulder. You have abduction and adduction. You have internal and external rotation. So you've got a lot of movement in the shoulder, and you've got a lot of anatomical structures involved. Okay, so you can see here. Most of us probably know the humerus is your arm bone. Okay, the head of the humerus, that's the ball of the ball and socket joint. Okay, the shoulder blade or the scapula is the socket portion of the ball and socket joint. Okay. The shoulder complex or the shoulder joint attaches to the rest of your body via the clavicle or your collarbone here. Okay. And then we all probably know about the rotator cuff. So you have 4 rotator cuff muscles. So you have your supraspinatus muscle, which is the one that's kind of on top here. And then you have your infraspinatus and your teres minor. And then on the underside of the shoulder blade, so between your shoulder blade and your rib cage, you have the subscapularis muscle. Okay, those 4 muscles combined make up the rotator cuff. If you look down here, kind of the bottom middle portion of the page, I don't know if you can see my mouse very well or not, but there's kind of a side view of the shoulder blade or the scapula. And you can see kind of the white ring around that right there. That's your labrum, and that kind of increases the surface area of the socket. So the rotator cuff muscles, their job is to keep that head of the humerus sucked in nice and tight into that socket, or the glenoid fossa is the medical term for it. So that's just a little bit about the anatomy of the shoulder. As you can see, there's kind of a lot involved. And so as such, there can kind of be a lot of things that can potentially go wrong. Okay, so like I said before, there's kind of a lot going on with the shoulder, and the shoulder is probably one of the most mobile joints in the body. Okay, so you have a lot of mobility, you have a lot of degrees of freedom, but that kind of comes with a give and take. So with increased mobility, you also have decreased stability. Okay, so going back to kind of the knee example, the knee is a pretty stable joint, okay, and it only has, like I said, the flexion and extension movements. The shoulder can move in many planes and many degrees of movement, but coming along with that, involve that what comes with that is instability. Okay, so we're going to talk about some of the most common shoulder problems that we see in the clinic here. And probably one of the biggest perpetrators or one of the biggest culprits of shoulder problems is bad posture. Okay, so posture is huge when it comes to shoulder problems and, well, and of course, neck problems and back problems. But um, bad posture is a very common denominator in shoulder problems. So that is something that we always address with any shoulder patient that we see, because it's usually a problem, and we can all work on our posture. Okay, so some other common problems: arthritis. Okay, kind of see more of this with the older population. Stiffness, achiness. Okay, fractures. Tendinitis is a very common thing that we see, especially, this time of year as we're all kind of doing our spring cleaning and getting back out into the yard and things like that, and we're reaching overhead and doing things, and kind of we often see people coming in with flared up shoulders. Bursitis, kind of running along the same lines there. Shoulder separation. Okay, so you can have like a subluxation or a dislocation of your shoulder or your AC joint. We'll see a picture of that, an example of that here in just a minute. Impingement is a very common thing that kind of goes back to the posture thing. So impingement is where those rotator cuff tendons, let me go back, sorry. So with impingement, those rotator cuff tendons are kind of getting pinched. There's the space underneath the shoulder blade. It's called your subacromial space. And with bad posture, that space actually decreases and kind of pinches more on those tendons. And that's when they get, that's when you get the tendinitis. That's when they get inflamed and angry. And that's what impingement is. And it's very common. Okay, diving a little bit deeper into each of those. So arthritis, we'll kind of take a deeper look at that, and we'll take a look at some pictures here. So here is a normal shoulder joint, or this is a radiograph or x-ray of a normal shoulder joint. Okay, so you can see the humerus, the ball and socket. You can see the collarbone. You can kind of see the shoulder blade in the back there. So with this one, the biggest thing that we're noticing here is there's good joint space. Okay, there's a good amount of space between the joint here, and everything's aligned up nice. So with arthritis, you'll kind of see some extra calcification, or bone spurs, sometimes they're called. So if you see here, there's some calcification on the top of the head of the humerus right there, and then on the acromion here, that's the top of the shoulder blade. You can kind of see how that kind of juts down towards that, And that's the space where those rotator cuff tendons come through. So a bone spur is a common cause of rotator cuff tears, because that bone can kind of be digging in and impinging on those tendons, and over time they can kind of fray and tear. As this is a really good example of an arthritic shoulder joint. Okay, so you can see the joint space narrowing. Okay, so like over here in the normal, there's like a good space between the ball and socket. Over here, you can hardly see there's any space at all. Okay, that's a very common sign of an arthritic joint. Okay, here's an example of a shoulder separation. This is an AC separation. So your AC joint is your acromioclavicular joint. That's where the end of the clavicle or the collarbone attaches to the top of the shoulder blade there. And you can see that that has been separated in this case. Here's a picture of a fracture. Okay, bursitis and tendinitis. So you have bursa around your joints. Bursa are just kind of like the small fluid-filled sacs that kind of lubricate around the tendons and the joint, just make everything kind of glide smoothly when you move your joint. Okay, so with impingement and other things like that, those bursa can become inflamed. Same thing over here. So you've got the tendon can become inflamed and angry. This is usually caused by an overuse injury. So, or if that acromion, if that has a bone spur and is kind of pinching down and aggravating those tendons, that can be another reason why you get a bursitis or tendinitis. Okay, rotator cuff tears or bicep tears. So here's a picture of a partial rotator cuff tear. You can kind of see the degeneration there. There's a saying that we sometimes use, and we say, treat the donut, not the hole. So the good news is with partial rotator cuff tears, they actually respond in most cases very well to physical therapy. Okay, so sometimes you hear, oh, I have a partial rotator cuff tear, and that can be kind of scary. But the good news is that with conservative treatment, these actually do very well. Okay, here's a picture of a complete rotator cuff tear. In most cases, these are from trauma. So a traumatic injury or accident is when you'll see this happen. And in most cases, this requires surgery. Okay, your biceps tendon. So sometimes the long head of the biceps is sometimes considered the fifth rotator cuff muscle or the fifth rotator cuff tendon. And sometimes that long head of the biceps can tear or pop off if you do something crazy in the gym or anything like that. So the good news with that one though too, so the biceps has two heads, right? And so if that one tears, if the long head of the biceps tears, you can still have full function of your shoulder and your arm because you'll have the short head of the biceps that attaches right there. So usually they don't do anything with surgery for that one, but you'll just have a cool Popeye muscle because when the tendon pops, that part of the muscle kind of shortens up and you'll have this big Popeye muscle. Frank has one of these, so if you ever see him, tell him to show you his Popeye muscle. Okay, so back to posture. Like we were talking about, posture is a really, really huge thing when it comes to shoulders. Okay, so we've got kind of some examples of poor posture here. We have some funny pictures at the bottom. Okay, so a lot of us struggle with posture. It's something that we can all work on, but a lot of times you'll see that kind of forward head posture, and you'll get the rounding of the shoulders. Okay, the shoulders will kind of round forward. If you think about it, we do all of our work in front of us throughout the day. So the muscles in front, the muscles of our chest and things like that, they get really tight, and those muscles will pull on the shoulder joint, like they kind of pull that head of the humerus forward and jam it in, and that's when you get, the pinching. And so that's why posture is so important. Here's some more pictures kind of showing examples of poor posture. So a lot of us who may be working from home at this point because of the coronavirus, I want you to make sure that while you're working, you're being conscientious of your posture, because that has, over time, that those things add up. And so if you're spending more time on the computer now or more time at home, make sure you're taking breaks. So we tell people to take breaks, every 15 or 20 minutes. Just move your body, get up and down, move around the room. Just a little break, something just to get up and move a little bit. Make sure that you have some lumbar support. Okay, so if you get some good support behind your lumbar, that will kind of straighten everything else up the chain. Okay, so that's really important. Make sure that your monitor is at eye level so that your neck isn't, cricked up or down, anything like that. So posture is huge when it comes to neck and back and shoulder stuff. Hey, posture, we're just going to keep harping on this. We're just going to hammer this into you guys. Posture is so important. So with exercising too, it's really important that when we're exercising, and I hope you guys are doing what you can to stay active at home during this time. I know that the gym is closed and a lot of us are kind of missing that, but I hope you guys are still doing things to stay active. But posture is even important when we're exercising, okay? So if our joints aren't aligned in a good position, and then we're putting that under, high load, that's when you run into injury and that's when you run into problems. Okay, so here's some really poor examples of posture and probably some bad exercises to do. So you see this guy with the dumbbells, his neck's all cricked up, and we see a lot of people working their upper traps. Okay, so those big muscles just below your neck, and there's really no reason why you need to train those muscles, because they're usually overactive and very tight in almost everybody. So you see those people doing those shrugs in the gym all the time, and that's really not necessary. What you should be training is your lower trapezius. Okay, so that muscle is chronically weak and underactive in most people, and most people don't know that they should directly or specifically train that muscle. Okay, so instead of doing shrugs, try training your lower traps. This middle picture here, you see that guy, he's doing the upright rows. And that is an exercise that we would probably never, ever recommend. Just because, again, you're kind of working those upper traps. And when you pull the bar up like that, you're actually going into a position of shoulder impingement. You're going into the exact position that we would put your arm in to test if you have symptoms of shoulder impingement. So everyone likes to work the muscles they see in the mirror, right? So the muscles in front of our body, they get overactive and tight compared to the muscles in the back. Okay, and so what happens because of that, like I said before, the those muscles, like your chest muscles and the muscles in the front, they kind of pull that head of the humerus forward and jam it into the joint, and you get that rounding of the shoulders. What we really should be doing is training more of the muscles of the back, okay, to kind of even things out, pull that head of the humerus back more into a more appropriate place. So it's very common to kind of have muscle imbalance where we see, tight, overactive muscles in the front and weakness of the muscles of your posterior chain. Okay, so here's some more pictures of some bad examples of posture and body mechanics in the gym. This guy here doing the deadlift, man, look at that guy's back. That guy's just looking to throw out his back or herniated disc any day. And then as he's looking up, his neck's cricked back. Okay, you see this guy doing the bicep curls. He's leaning back, arching his back. This middle picture right here is probably one of our other pet peeves that we see in the gym quite often. You see people using the lat pull down machine like this, and they pull the bar behind their neck instead of in front of them here. First of all, what that does is just kind of strains your neck quite a bit. And then the second thing is that when you're pulling the bar down like that behind your neck, that actually the biomechanics of it on the shoulder joint, it actually kind of causes the shoulder, it destabilizes the rotator cuff. So there's never really any reason why you would need to use the lat pull down and pull it behind your neck. So do it the right way and pull it in front of you here. Your shoulders will thank you. So if you have mild shoulder pain or dysfunction, you can usually manage it pretty good with just some basic postural stretches. Okay, so here's an example of a pec stretch that you can do in the doorway. Okay, this is one that we sometimes use. And so almost every shoulder patient we get will get some type of chest opener, some type of stretch for the chest, because we get a lot of tightness there. So some postural stretches and just some basic strengthening exercises. So you probably would want to avoid, if you're kind of having a shoulder flare up, you'd probably want to avoid any type of overhead exercising or overhead reaching, just till things kind of calm down. Because when you're reaching overhead, that subacromial space where those rotator cuff tendons are, that kind of decreases with overhead reaching. So we usually advise that if you're kind of having a flare up, that you don't do a lot of overhead reaching till things get calmed down. Okay, so here's a cool quote from, this is kind of going back to the rotator cuff partial tear stuff. This is a cool quote from a research study that we saw. So a recent study from Finland asserts that when it comes to treatment of non-traumatic rotator cuff tears, okay, this is partial tears from, this is non-traumatic, so this isn't from an injury or anything. This is just kind of wear and tear over the years. Physical therapy alone produces results equal to those produced by arthroscopic surgery and surgical repair. So down at the bottom, so conservative treatment should be considered as the primary treatment for this condition. So before you run and head to the doctor to have them cut you open, please give physical therapy a try. It's always better to try conservative first, and then if that doesn't work, then you can look at your other options. But it's always best to try physical therapy, because we usually have pretty good outcomes with this. Okay, so, but what if the pain is severe? Okay, what if it's really bad? What if you can't participate in your normal work activities or recreational activities? What if what if it's so bad you can hardly move your shoulder? The motion is really restricted. What if it's so bad it's keeping you awake at night? If you have more significant shoulder pain and dysfunction, you have three choices. You can just ignore it and keep suffering. You can mask it with medications or injections. Okay, you can run to the surgeon and have him cut you open. Or, like we talked about, you can try conservative first. Okay, you can talk to your doctor, get him to write you a physical therapy prescription, and let us help you. Okay, we have a lot of success with shoulder stuff. Okay, it's kind of one of the easier things to treat. Backs and necks are very common. Sometimes those are a little bit more involved and a little bit more complicated, but most of the time, not all the time, but most of the time, shoulder stuff is pretty easy with just kind of some little fixes, little tweaks here and there that we can work on. Okay, well, hey, we want to thank you guys, any of you who joined us live today. We really appreciate it, and we hope that this information has served you. So thanks for joining us, and if you have any questions, okay, you can chat Frank here now, or you can post your questions on this video afterwards. This will be posted to our Facebook page, so you can go back and watch the recording, and we will be looking for any questions there. Please give us a call. So we are also offering free consultations right now. So the club is closed, but we are open just inside the little clinic here. We're letting people in the back. We're wearing face masks and we're sanitizing everything like crazy. We're only scheduling, one person each an hour, so we're keeping everybody spread apart. So if you're really struggling with a shoulder problem right now, or if you have a friend or family who's really hurting and really needing that right now, we are still here for you. So give us a call and let us know. You can also email Frank here. There's his email, fromney@physical.com. Like I said, if you have friends or family who might benefit from this information, let them know. We're trying to be more proactive with our social media presence, so you can go take a look at our Physical Therapy and Balance Ogden Facebook page, and on Instagram we are physical.therapy.oac. There you go. Okay, another option during this kind of weird time of the COVID-19 coronavirus, we are offering the telehealth. Okay, so a lot of the insurance companies are kind of getting on the bandwagon right now, and they are starting to pay for telehealth. If your insurance doesn't currently offer that, but they probably will here in the near future because a lot of them are doing it. But if they currently aren't, we do have a self-pay rate, which honestly isn't really much more expensive than your copay probably is. So if you're not comfortable coming in to the clinic for an appointment, this is an option for you right now. Hey, if you enjoyed this, please like our page and let us know. We hope this serves you. And that is the end of our presentation. Thanks for joining us. And like I said, if you have any questions, please give us a call, 801-476-2000.